Hello, my name is Ron Ekstrand, CEO of Easterseals, Arkansas. Today is May 20, 2020. On behalf of our organization, we hope that you and your loved ones have remained safe and are doing well during this COVID-19 pandemic. I am happy to report that we do not have any known positive cases of COVID-19 among our staff or any of the individuals we are continuing to serve in our currently open programs. Keeping people safe has always been our number one priority. Today, I wanted to provide you with a brief update with regards to our currently closed programs and our plans to begin reopening starting on June 1st. Our currently closed programs include our Little Rock and Stuttgart developmental preschools and our adult day program at the Center for Training and Wellness. The criteria. Easterseals Board has helped us establish 5 criteria that we are using to help determine when it's okay to reopen closed programs. First, what is going on in the community as it relates to COVID-19 trends? How are the cases trending? What is the severity of those cases? Does it appear that we are in the midst of a secondary wave of infections? If so, we will tap the brakes on reopening and slow things down. If things continue to trend positively, we will continue with our reopening plans. Secondly, what is the availability of personal protective equipment? Do we have adequate supplies and access to acquire personal protective equipment like gloves, masks, hand sanitizers, cleaning supplies? If not, we will have to slow things down. Family readiness. How are our families feeling about sending their loved ones back to our programs? Based on calls with program directors, we are gauging that right now and have planned phases to reopen each one of our programs. Next, staff availability. Do we have the staff ready to handle the families' loved ones who are coming back? If not, again, we will have to slow the reopening. Without staff, we cannot reopen our programs. Last is economic viability. Can we afford to open a program with reduced attendance? Or will the revenue be so little that it won't cover our expenses? Given the current fundraising environment that we are in, it's been a challenge for us to subsidize programs that do not cover all of their costs. Health and safety measures. I want to spend a minute to tell you what we are doing to try to ensure the health and safety of the individuals we serve, along with the staff who serve them. We've been constantly monitoring and carefully implementing all of the recommendations that are coming from the Centers for Disease Control and Prevention, or the CDC, Governor Hutchinson and his team, including the Arkansas Department of Health, and other state and local health agencies. As part of our reopening plans, among other things, we will be implementing the following measures. Staff training. Prior to reopening, all staff will be trained on the increased daily cleaning protocols we have and on the appropriate usage of masks, gloves, and other potentially required PPE. Personal protective equipment. All staff will be provided with the equipment that they need to adhere to all of the health and safety guidelines coming out of the CDC, the Governor's Office, and the Department of Health. Daily screening. Every person who comes into one of our buildings will have to be screened, and that includes not only having their temperature taken, but a questionnaire designed to detect any potential exposures or active symptoms of COVID-19. Social distancing. In order to allow for social distancing and meet guidelines, as much as possible, we will be keeping group sizes to 10 and under, and we will limit the amount of time people are migrating around the building. This will also help reduce the likelihood of infection. Daily cleaning. Before reopening, all program spaces will be deep cleaned, and all high-touch areas every night will also be cleaned and sterilized. Finally, hand sanitizer stations. Throughout our facilities, we are installing hand sanitizer stations outside of classrooms, therapy treatment rooms, break rooms, and at each entrance. This will enable staff and visitors to ensure their hands are washed. And finally, visitors. Visitors are being limited during this time to ensure that we limit access to the potential of an infection. Now, despite all these precautions that we are taking, let's be really clear here. Because this is a novel virus and it has been evolving, there's no way we can completely guarantee the health and safety of all of the people we serve or our staff. We can promise, though, that we will do everything in our power to make sure we meet and exceed all health and safety guidelines handed down to us from the public health experts. However, at the end of the day, we recognize that each person must make their own decision about what is best for them and their loved ones. In terms of timing, based on what we know today about community COVID-19 trends, the availability of PPE, and current family readiness, we are targeting Monday, June 1st for phase 1 of reopening. During phase 1, we are going to be focused on older children at the preschools, saving the younger children for later, another phase, and the adults at the day program, those who need the least amount of personal attendant care, hands-on care, in other words. That way we can limit and mitigate the risk of any kind of spread of the virus. Phase 2 will be occurring sometime mid to late June or possibly early July, again following the trends and the interest in families in returning. To prepare for phase 1, we will be bringing back staff on Tuesday, May 26th for their health and safety training, as well as program planning and preparations. We put health and safety of the individuals we serve and our staff above all else. They are our top priorities. We are excited, very excited to be welcoming you back and can't wait to see you again. We look forward to seeing you soon, and in the meantime, stay safe and stay healthy. And if you have any questions or suggestions, feel free to reach out to me or the rest of the leadership team by sending us an email to covid19@eastersealsar.com.